Hi, I'm Dr. Jay Calvert. I want to talk to you a little bit about scheduling surgery and the fees involved. Typically, when you're ready to schedule your operation, you call in to our patient care coordinators and let them know that, hey, I'm ready to have surgery. This is going to require a deposit to hold your surgery date, and a discussion of how the operation will get paid for will happen at that time. Some operations have just a plain cash component, which is probably the majority of what I do. They're just plain aesthetic operations. There's no functional aspect to it, and you're going to make payments up to the time of surgery to be ready to go to the operating room. With that said, some operations have a functional component. Many of the nasal operations I do have a functional airway component, septoplasty, nasal valve reconstructions, there's rib graft needed, and same with some of the breast operations if there's breast cancer reconstruction involved. This means that we need to get authorization from your insurance company for that portion of the operation. And there will be a hybrid of cash and insurance payments that will be occurring. Once you understand your financial responsibilities, then you can go ahead and schedule the operation and it will proceed forward. The cost of operations varies tremendously. We often get direct messages on Instagram, contact forms through the website, Facebook inquiries, emails that basically say, how much for a rhinoplasty? How much for a breast augmentation? We really can't give you a price until we know what operation it is that you need and how long it will take. The three components to a surgical cost, if you will, are the surgeon fee, the anesthesia fee, and the operating room fee. There may be additional fees such as implants or garments, other devices that may be involved, but those fees are delineated very clearly in your surgical quote. Understanding that, you need to realize that there are three separate entities that are billing you for the surgery: the operating room, the anesthesiologist, and me, the surgeon. This often gets confused. People think there's a package price for things, and it can be a problem if you don't understand how the fees are generated. And I would like to be extremely transparent about what is being paid for by whom or by what entity if insurance is involved. Because once insurance comes in, it's a whole nother animal. This gets very confusing. It's a source of problem when trying to figure out your financial responsibility. But rest assured, my staff is extremely experienced, able to walk you through these fee issues and get clarity so that you feel extremely comfortable and know what your responsibilities are. There is nothing worse than getting bills after surgery. And when it does happen, like a pathology bill comes in or something which you weren't expecting, and by the way, there are pathology bills. If you read your paperwork, and we're going to send specimens, the pathologist is another entity, and you have to understand that. It's in the paperwork, and I'm explaining it here now because I want you to realize that we want you to know everything that you need to know about what it's going to cost to do these operations. It's very important to me that you understand what your financial responsibility is and how you're going to meet it so that you don't have any surprises.